All right, welcome everyone. So as we get going, Chelsea and I are just going to introduce ourselves. We're going to introduce and orient everyone to the purpose of this workshop, and then we're going to get going. So to introduce myself a little bit, my name is Pacifico Gonzaga. I'm a psychology resident here at PSM. I really focused on in my research and my training program, social ecological resilience, which is a fancy way of saying of like how do communities and how do people recover from hardships, especially based around like relationships and the things outside of themselves, not just like grit or hard effort and stuff like that. I'm originally from rural California, from a place called Modesto, California. So it's a very underserved and impoverished area of California. And I've made my way to Maine. This is where me and my family live. We kind of want to stay here and put down roots here. Chelsea, do you want to take it away?
Absolutely. I'm Dr. Chelsea Cogan. I'm a licensed clinical psychologist here at Psychology Specialists of Maine. My primary area of specialty is under kind of the umbrella of trauma and other related disorders and symptoms. I am a Maine native. I've lived all over and recently made my way back here, and am excited to be able to share a little bit of knowledge with the community that I love and am excited to get back to.
Okay. Oh, 1 second. Is it showing defining trauma? I apologize.
It is.
Okay, all right. My slides are being weird. So first, our topic for tonight is we wanted to cover mental health concerns that arise and come up often after trauma. So we want to be clear about what we're talking about. Since about the 1980s, the word trauma has seen just a dramatic increase of usage in our society, especially after Vietnam and working with a lot of Vietnam veterans. But then there was also a lot of consideration and research around sexual abuse survivors. And now it's kind of just used in our culture. We hear it kind of everywhere, or at least I do. People talk about trauma this, PTSD that. We have trauma-informed care in all kinds of ways. I mean, I even saw something about like trauma-informed dentistry. So it's kind of a buzzword, at least in the mental health world. And also we just hear it, in life. And just to be clear, like there is different definitions of trauma. So one is the DSM-5, or the Diagnostic and Statistical Manual of Mental Health Disorders, is kind of like an authority within the mental health field. It's updated, but it's kind of like this aggregate of mental health research, mental health experience, clinical experience, and it's a way where we define what is a mental health disorder and what criteria meets if someone is having a certain set of symptoms, what mental health disorder might that be? And the DSM-5 has a very narrow definition of trauma, and it defines it as exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: either directly experiencing it, like it happens to you, witnessing it in person, so you're seeing this trauma unfold, learning about these traumatic events having occurred to close family members or a close friend. And from a very strict technical sense, if you experience this, you experience trauma. And if you did not experience this kind of event, you did not experience trauma, at least according to the DSM-5. There also is an important question that arises of, we live in a society where there's media, there's Instagram, there's TikTok, there's 24-hour news cycles, and you can go online and see all kinds of horrible content, even intentionally or unintentionally. So there has been kind of this question of, can you develop or experience a trauma vicariously or through media exposure? According to the DSM-5, this doesn't happen or doesn't count unless it's work related. And I believe, if my understanding is correct, this was really about like police detectives and stuff like that. So they might not have been at the scene of a crime, but they're watching horrible crime images as they're going about their duties, and then they develop PTSD symptoms from that. So very technically, according to the current DSM-5, like you can't just watch a video on YouTube and count that as an exposure to trauma. However, it's important to keep in mind that the DSM-5 goes through the revisions. It's on its 5th revision right now. And this is based on professional consensus, new research, and deliberation. So that changes. And the definition of trauma presented in the DSM-5 has already changed, and I believe will change in the future as we move forward. There are other broader definitions. And this is partly because research suggests that people can have the classic symptoms of what we define as trauma-related disorders, even when they don't encounter one of these very strict DSM-5 traumas. So some broader definitions have been suggested, such as events that are psychologically and overwhelming for individuals, families, and communities. One that I often use when I'm working with clients, if they bring up the concept of trauma, is like a stressful event that is beyond the capability of a person to fully address when they experience it. So at the time they experienced it, it was just beyond their current capacity.
All right. This is me, the common
Yeah.
experiences after trauma. I apologize in advance. Of course, as soon as I'm starting to talk, I can hear my cat throwing a fit over in the other room. So if you hear any meowing in the background, I promise all my cats are well. They just want to be out with me right now. So I'm going to be talking a little bit about what are some common experiences after trauma occurs. Like if you experience a traumatic event, or are around a traumatic event, what might you be able to expect to notice within yourself? Within kind of the DSM-5 framework, we usually think of these reactions in these major 4 areas. We think of intrusive or re-experiencing symptoms. So these could be things like you are minding your own business, sitting on the couch, trying to watch TV, and then boom, all of a sudden, you have a memory or a thought or a reminder kind of bringing you back to the traumatic event. This could be something along the lines of having nightmares or bad dreams about the event that are really upsetting. It could be having an emotional reaction or a physical reaction, right? Such as increased heart rate or sweating, kind of feeling dizzy when something reminds you of the trauma. Maybe you see it on the news, maybe you see something in a TV show that reminds you of it, and it kind of stirs up those different symptoms for you. Sometimes people also experience flashbacks here. So really pulling themselves back, they get pulled back into the moment of the trauma and lose touch with what's happening around them. Some of these are more common intrusive or re-experiencing symptoms than others, but these can occur after an experience of trauma. We also sometimes see individuals engage in what we call avoidance, and this can look a lot of different ways. Here we're thinking about avoiding people, places, or situations that might remind you of the trauma. So thinking directly about the Lewiston shootings, maybe people are avoiding going out to restaurants, going out to, or like driving down the streets where things were closed down, right? Because it brings up those reminders. So they figure if I just avoid it, then I won't have to think about it. Right? We also see avoidance of thoughts or emotions related to the trauma. So maybe if a thought pops up, you try to push it out through whatever means possible. For some individuals, this can include drinking, it can include sleeping, it can include over-exercising, right? You can use a lot of different things to try to distract yourself from these thoughts and avoid the thoughts and feelings. We also see changes to our thoughts and emotions just in general after we experience a trauma. And unfortunately, oftentimes these are not positive changes. These aren't things that tend to feel the best. We see increased negative emotions. So we see things like sadness. Sometimes we see shame or guilt. If there was any feeling that maybe you were involved in some way in the traumatic event, we sometimes see anger or intense fear as well. For other people, we see complete numbness, no highs, no lows, just numb. And yet for others, we see an inability to experience positive emotions. So if something really good, really wonderful is to happen, they're spending time with someone they care about, they win the lottery, they can't connect with that happiness in the same way that they may be used to. We also see these changes in the way that we think and feel about ourselves, other people in the world. After an experience of trauma, people might have the thought of, well, if I had just done more, if I had just done something differently, it's my fault, right? Or they might think, I can't trust anyone. People can't be trusted. The world is entirely dangerous. And then that kind of increases that likelihood of avoidance because it's really tough to deal with those thoughts and to encounter other people that we might have some fear around. We also in this area see a loss of interest in the things that you used to enjoy, maybe because they don't bring that same amount of joy, or maybe because there is some negative emotionality tied to them. And we see a disconnect from people that we care about. It's a little bit like there's a barrier between us and others. It can be hard to connect and find that way forward to be vulnerable and share with others. We also see kind of the fourth area that we think about is increased arousal. This is kind of what people often think of when they think of a trauma response. They think of kind of that head on a swivel, making sure you know what's going on around you, who's coming in, who's going out, where your exits are, what cars are coming and going down the street, what your neighbors might be doing. And after an experience of trauma, that's just straight vigilance, right? That makes sense. But when we see it lasting a little bit longer, that's when maybe we're dealing with something a little bit more requiring some professional attention. In the increased arousal area, too, we see some difficulties with concentrating. This makes a lot of sense because here people will be kind of battling their own thoughts, battling their own emotions, trying to distract. So if you are battling all of that, it's going to be really hard to read whatever page is in front of you and retain that information. We also see difficulties with sleep, falling asleep, staying asleep, or waking up too early. And sometimes we see increased irritability or increased risk-taking behavior here. And I want to note that while these are some of the symptoms that make up PTSD, post-traumatic stress disorder, all of these symptoms make sense in the short term following a trauma. They are common experiences after trauma that do not necessarily mean a person has post-traumatic stress disorder. If we have experienced something dangerous, it makes sense we want to avoid it, that we are keen to look around our surroundings and avoid anything that might make us think about it or feel about it. It would make sense that we're being jolted awake in the middle of the night to keep ourselves safe. Right? So all of these are common experiences. They can be common and normal in that period of time after a trauma. And then we also have additional common experiences after a mass trauma. So when we think about mass traumas, what comes to mind and kind of the reason why we're having this talk in particular is the Lewiston mass shooting. But that is not the only mass trauma. For better or worse, there is now a body of research on this area because mass trauma has existed for a little bit of time in our history, or a long bit of time in our history, and we're getting around to understanding it a little bit more deeply. So these are just some of the things that can happen after there is a mass trauma. The people who survived it might experience what's known as survivor's guilt. Why did they not make it and I did? There can be recurrent thinking about the event. Even though you're trying to go about your day-to-day life, you're pulled back to the event. There can be this kind of general feeling of being on edge. You aren't really quite sure if there's something wrong, but you are aware that something doesn't feel quite right. And then we have a couple of points here that are more in that diagnostic criteria or fit for like a disorder. PTSD, acute stress disorder. Sometimes we see anxiety or depression as well. And then down under the second kind of column of bullet points is complicated grief. This is really, all grief in a way can be complicated, right? There's a lot of different emotions coming in at different times with different thoughts and feelings attached to it. But complicated grief is long lasting and interferes with your ability to engage in your life in the way that you want to after a loss or a trauma has happened. We can also see just that general negative affect, right? It's a little bit harder to have those positive emotions, a little bit more gloomy. We see poor sleep often after experiences of mass trauma, intense dysregulated emotions, kind of on that roller coaster. Sometimes we also see physical health concerns, as well as an increase in the perceived stress level an individual may be experiencing. And one of the points that's really important to consider here is that it is incredibly common after an experience of mass trauma to have a loss of that sense of safety. And I think that from my work with the people who I work with in Maine, that's a common thread I've heard after this, is that everyone felt pretty safe in Maine before. And now this has really rattled that sense of safety.
Hey, Chelsea, I also realized, now we have most of the people here. I did want to jump back a bit because we skipped over this. My slides were not behaving appropriately. So now that we're a little clearer of like trauma and generally speaking, what we're talking about here, I want to be clear that trauma is very common. I think we were talking a little bit earlier before it started, but 90% of adults, according to some research, will experience trauma in their lifetime. Oh, there we go. Here we go. Correct slide. Sorry, the display is really messing with me on my end. So obviously on October 25th, we had this big mass shooting and then the lockdown and then this fear of where is he? Is the perpetrator still at large? Is it going to happen again for a couple of days? But that's not the only trauma facing people in Maine, even right now. And it's a safe bet that many people in Maine experienced trauma before this event, even if they weren't directly impacted by this event. Just from that research of it's very common in society is all. So that leaves us with a question of, okay, if we know what we're talking about, and if we know what the common symptoms are, and if we know it can lead to disorders, how do we as a community, everyone, like respond? And I've been in this training program. I've been trained to be a psychologist. We talk about trauma. We talk about treatment a lot. So sometimes we can forget that this isn't really common out there. But I also have a time before I was in mental health and different careers. And I remember in my hometown when trauma was occurring in my hometown, when traumas were occurring in my community and the kids that I work with in youth ministry, I was just really left in the dark, right? Or with little guidance and probably a lot of questionable information about trauma that I was just kind of getting secondhand from life. So that brings us kind of the purpose of tonight, right? Tonight, we really wanted to equip members of the Maine community with important information about mental health concerns that come up after trauma and these symptoms that commonly occur after trauma. And our hope is that this information better equips people to respond in their lives, if they see it in their own life, if they see it in their family's life, and also their broader community. We are going to have a time of question and answer at the end where you can bring up stuff, but we want to be clear, like this isn't a moment to process traumas, to go into detail about your experiences, to vent your emotions. This is an educational moment, right? So we want all questions and comments eventually to pertain to that. So now moving forward a little bit to where we left off. One of the first things that we can do after a trauma, right? So a trauma has ended, basic safety has been established. This is a really good time for everyone, right? And everyone can engage in this mental health first aid, or sometimes it's called psychological first aid. So these are concepts that like non-professional mental health interventions and strategies that can be used to provide mental health support for people in the moment, in the wake of any kind of stressor or event, including trauma. In the same way as you might use a first aid kit to address hurt, and you don't need a hospital, sometimes mental health first aid is all that people need. So some of these strategies that you can use might be all people need in a moment, and then they're going to be okay, right? And with enough time. Other times, after a trauma, if we engage in mental health first aid strategies, if we try to help our community and connect with those that might be impacted, it's very clear that like it's not enough. And in that case, we offer that same kind of support with the same strategies, but then a goal is connecting them with professional help, right? So a very common acronym that's used to teach basic mental health first aid strategies is this ALGE acronym that's being presented. So one is if, there's been some kind of trauma in my community and I'm showing up to kind of help and engage in some kind of preliminary mental health first aid, right? First step assess, right? For suicide or harm, right? And that is often just as simple as directly asking, right? Things are bad right now. You just went through this. Are you thinking about self-harm or suicide at all? There's been a lot of research that asking people that directly does not put the idea of suicide in their brain. So there doesn't need to be any concerns about that. If they say yes, or if you get the sense that they are in that space, definitely want to make sure that they get connected with professional help. Next step in ALGE is just listen non-judgmentally to whatever they've got going on, whatever they need to say in the moment, right? G is give reassurance and accurate, I would add accurate information, right? So we're listening not judgmentally, we're encouraging them, hey, like you survived, we're okay, the trauma ended, we're going to get through this. You're going to be okay in the long term. And you could be providing information about resources to connect to. You could be providing information about where to go for safety and security in this moment, if those are still concerns. You give information about like mental health. You could say, okay, I see you shivering right now. This is just a reaction to the trauma. You're going to be okay. This will pass, right? We also want to encourage appropriate professional help if necessary and encourage self-help and other support strategies. So it could just be like, hey, make sure that you keep talking to people about this until you feel okay, right? It could be, hey, I want to make sure that you're kind of checked in with yourself over the next couple of days to kind of just monitor to make sure your symptoms are going away and not getting worse. Also, there's sometimes this question in mental first aid of how do I know if someone needs professional help? If there is risk of suicide, if there is risk of self-harm, those are some pretty clear indicators that yeah, professional help might be needed in this moment with this person. Also, I really also encourage people to just trust themselves and our ability to be intuitive with other people. Human beings are social creatures. Trust your instincts. We are tuned into each other. If you're talking to a family member or a friend after some kind of crisis in this kind of mental health first aid space and something feels off, that might be a time to really encourage them and do a warm handoff to professional services, right? Or just monitor, right? And kind of keep checking in with the person in other conversations as well. Something to keep in mind is in this initial stage of kind of like mental health first aid, the trauma just passed, is someone who's directly exposed to the traumatic event, someone with limited social support, someone with prior traumas in their life, someone who's got ongoing adversity, so a chronic health issue, poverty, a divorce proceeding, like something that's already stressing them out that's going to keep happening. If they were personally injured or lost a loved one in a trauma, those are all people that are at greater risk for more symptoms and more intense symptoms and potentially disorders. So as you're talking to someone and listening to them, you also want to be in the back of your mind, okay, is there direct exposure? Is there a limit? Do I know this person has other people to talk to? Who are they connected with? Maybe you know that they've experienced, violence or car accidents or something else before. Maybe you know they've got a lot going on. So all those, the more indicators of those you kind of hear, yeah, maybe it'd be wise to encourage professional help, even if they might say, I don't know if I need it. Just to check in and be okay. In terms of maintaining your own mental health in the wake of a trauma, right? There are a couple basic things that we encourage, right? One, don't label a normal response as abnormal or beat yourself up over it, right? Everyone is going to have a reaction to traumatic events, especially the closer we are in terms of time and the closer we are in terms of being impacted by it. It doesn't make someone weaker or stronger to have these reactions. Again, as Chelsea said, they're actually adaptive. They're coming from our evolution. They're coming from a place of our body's reactions trying to be helpful. And most times people, including ourselves, don't really need a lot of support other than, some connection and some resources after an event, right? So having a response to trauma doesn't mean anything necessarily about you other than you're having a response to trauma because it's part of being a human being and experiencing trauma. A second thing to keep in mind is recovery is a process. Recovery can take time. It can take many attempts. It can mean learning and trying new skills. It's not going to look the exact same for everyone. The first thing you try might not be the thing that gets you to 100% of where you want to be. And we don't want to expect immediate or perfect results. So if you are impacted by a trauma more significantly, giving yourself some time and space and permission to just recover as a process is a good perspective to take. We also encourage people to return to normalcy and routine pretty much as quickly as possible and as realistic for a person. That's because a lot of studies have shown that avoidance piece that's very understandable and common after trauma actually can fuel and maintain trauma symptoms and keep them more powerful and drag it on longer. There's actually some really interesting research after 9/11, and they kind of compared people who could go away to individual treatment and then try to come back to New York later, and other people who were like, I have to go to work tomorrow, so I have to go confront all these fears I have about buildings and everything else, and see all these reminders of the trauma because I've got to go back to work and I have responsibilities that force me to kind of be functional. And they actually found out that people that were forced to be functional and stay in contact with those distressing things got better quicker. So the people that had the resources to go away into individual treatment, it actually took them a longer time to recover. So when we say return to normalcy and routine, we're talking like returning to school, returning to work, returning to responsibilities as a parent, right? This isn't about pretending that nothing happened, right? But this is about, okay, reconnecting with my normal day-to-day experiences because that puts you in contact with people, that keeps your mind busy, right? That forces you to re-engage with whatever kind of things you want to avoid, right? We want to do this wisely, but generally we encourage this return to normalcy and routine pretty quickly. We also encourage avoiding avoidance. Again, the avoidance can drag it on. So within reason, right? If you notice after a trauma, you or someone else is really avoidant of something like driving down a street, being around cars after a car accident, we want to gently and reasonably challenge that avoidance, not collaborate with it, right? And agree with it and just say, oh, I want to rescue you from your distress and I'll just drive you everywhere so you don't have to drive anymore because I know you're freaked out by cars after that car accident. That would actually maintain the symptoms over the long term. Avoidance can look very different for different people. Sometimes it can be overuse of substances to avoid thoughts or feelings about the traumatic event. It can be avoidance of sensory reminders like sight, sound, smells. It can be avoidance of specific people, places, and things. So we want to notice that in ourselves and others after a trauma and wisely and gently challenge it like where we're able. And finally, and I cannot harp on this enough, avoid isolation. And I put in there my acronym NORA, which stands for No One Recovers Alone. That is a general truism I have come to in my own work and in my research and in even my own research that I did myself for my dissertation. But we need each other. We need community. We need connection with other people to get unstuck and heal. And sometimes when we really get stuck with mental disorders, that isolation fuels it. After a trauma, it can feel very comfortable to kind of withdraw and want to isolate. However, this cuts people off from support. It kind of removes other people from being able to see them and to see that something might be off or interact with them and say, hey, something's still off with him after this event. Attachment and connection are just fundamental prerequisites for resilience and coming back from hardship in a lot of ways. So positive social support plays this crucial role in helping people recover. So for you yourself, for other people, notice maybe this tendency to isolate, reconnect with those that you feel closest to, those that will support you, encourage people to reconnect, even if they're not feeling it. So, and it can look very different, right? It could be going to a game night. It could be reconnecting with a spiritual community. It could be doing hobbies. The point is do something with people, even if you don't feel like it, in terms of that avoidance of isolation. All right, Chelsea, back to you.
All right. So we have some tips here on ways that you can work to maintain your mental health in the wake of trauma. We're thinking about this in two primary ways, although I would suggest that you do all of the above. We are really thinking about these in terms of how we can regulate our emotions, as well as how we can take care of our body physically, because physical and mental health are not separate. They are together. When you don't feel well mentally, you also don't feel well physically, and vice versa. So when we think about ways we can regulate our emotions, we think about kind of these coping strategies or emotion regulation techniques. And here I'm pulling a lot from a specific therapy, dialectical behavior therapy, or DBT. Really, if you Google any of these words I'm about to use, you can find all the stuff for free. When we send out the slides or when we make those available, I'm going to have kind of a cheat sheet readily available for folks on this too. So you don't have to remember, jot things down right away. But we're thinking here around tolerating distress and regulating our emotions. So if we are feeling heightened, if the emotions have gotten the best of you in the moment, these are times to bring yourself back down to baseline using some distress tolerance. So this could be a skill that we oftentimes use called tip, which is changing up the temperature. The T stands for tipping the temperature. And we do this because if we are in fight or flight, if things are becoming escalated within ourselves, this puts a real hard stop on it. Changing up the temperature by putting an ice pack on your forehead or kind of covering your temples or dunking your face in a cold bowl of water brings you back down to baseline pretty quickly. The I stands for intense exercise, right? If you've got this extra energy, burn it off somehow. Run up and down the stairs if that works for you. And the P in TIP stands for paired muscle or muscle relaxation paired with breathing, paced breathing. So pairing those two together, like tensing your muscles and then relaxing them while you focus on taking deep breaths down into your belly. Because oftentimes when we are experiencing acute distress, we are breathing shallowly into our chest because our brain is kind of taking things over and saying, hey, I have to get all systems in line so I can survive this moment. And that means I just got to go, go, go. A really nice tip, pun not intended, for using the paced breathing and really focusing on your breathing is if you put your hands behind your head and kind of hold your head back like you're leaning back in a chair, that forces you to take a deep breath down into your diaphragm. It is really challenging to take a shallow breath in that position. So this can really help pull you in, right? And bring things back down to baseline. So those are some strategies for when the emotions are really at their peak. But we have some other skills that we think of here, such as opposite action. Pacifico kind of chatted about this a little bit before in one of the slides, but if we are having a strong emotion, such as sadness, and that sadness is telling me I need to stay in the couch, I need to stay on the couch watching TV, not calling anyone, not talking to anyone. Opposite action to that is just that, doing the exact opposite. It is getting up, it's getting out of the house, it is talking to someone. It's not going to change the emotion immediately, and it won't do a 180 on it, but it will begin to slowly lay the groundwork for some change in that emotion. And you can do this with any strong emotion that you have. Say if you have a really intense emotion of anger and you want to approach and get angry with someone. Opposite action is withdrawing and kind of putting yourself away, putting yourself in timeout, or approaching with kindness instead of anger. If we're dealing with fear and that fear tells us to run, to get out of here, we approach if it is not an unsafe situation. We avoid avoidance, right? So those are some ways that you can use some distress tolerance and emotion regulation strategies to start to change up how your emotions are happening. We also have grounding on here. Grounding can be really useful in bringing yourself back down to the moment. That temperature trick is actually kind of a grounding thing because it helps to anchor you to the here and now. But we also have other ways that we can ground ourselves and take ourselves out of our heads and into the present moment. There's one that I really like called the 5-4-3-2-1. This is 5 things that you can see in the space around you right now and naming them out. And then 4 things that you can touch, you can physically feel. Then you move to 3 things that you can hear in the space around you. Moving then to 2 things that you can smell and 1 thing that you can taste. And by the time that you've done this and gone through the 5, 4, 3, 2, 1, ideally you're a little bit more in your body and a little bit more out of your head. So those are on our regulation or the regulating emotion side of things. But let's talk about physical self-care, because that is just as important. There is a huge amount of research out there that in the wake of a traumatic event, sleep and getting good sleep makes a huge difference in recovery from trauma. There are going to be some resources at the end of this presentation that will talk a little bit more about sleep specifically and give you a really good guide on how to do this. But my major takeaways here are making sure that you're keeping a consistent wake time. Don't stay in bed longer than you need to. Don't stay in bed hitting the snooze as much as you can because it feels too hard to get up out of bed. No, wake up at the same time every day and get up and get active. Don't go to bed until you are sleepy. Don't just crawl into bed and spend extra time there. The more time we spend in bed when we aren't asleep, the more our brain gets confused about what it is that we're doing in bed. So we want to make sure that we are only in bed when we're planning to sleep. We also want to make sure that we aren't doing anything active in bed, right? We aren't scrolling on our phones. We aren't worrying. We aren't, reading a book. All of those things can happen in a chair, on the couch, somewhere else, but they shouldn't happen in bed so that we can be real clear about what it means to be in bed. It means we're sleeping. And don't get hung up on, I need 8 hours of sleep. That's a myth, right? Some people do. But there's a range of hours of sleep that people need. It can range anywhere from 6 hours of sleep all the way up to 10. It's individually set. And so in the event that you notice some fluctuation in the hours of sleep you're getting, it's a data point for you, but it isn't the whole story. Just try to focus on getting as good sleep as you can. And this goes along with diet and exercise. Eating well to fuel your body and really focusing on that. Like, food is fuel. Food is not good or bad inherently. Food is fuel. Making sure you're eating the foods that make you feel good physically and mentally in the wake of a traumatic event can help you maintain your body, which can help you maintain your mental health. And exercise is so important for everything. And exercise doesn't necessarily have to be these intense weight training classes or CrossFit, like what happens down the street from me. This could just be walking around your neighborhood, right? It could be getting up and doing like a plank once a day. It can be whatever you need it to be, but getting consistent with your exercise can also help make sure you're sleeping well, which, like I said, sets that groundwork or baseline for everything. So these are some of our tips on how to maintain your mental health right after an experience of trauma.
All right, and another aspect of that for ourselves in our community is, and many people probably picked up on this, but communication is key, right? And I mean that with ourselves, with others, and then I also want to touch base on just like with children, right? So with ourselves, right, we want to kind of be aware and monitoring our own experience. We can recognize that, we have been through a distressing or frightening experience and we're having a reaction to it. We can accept and tell ourselves, okay, I need to accept this, that you're just not going to feel normal for a period of time. Things are not going to be normal for a little bit, but that will eventually pass. And then remind yourself daily when these things show up that you're managing, right? Try not to get angry or frustrated with yourself, have angry or negative self-talk, right? Oh, this is coming up again. This is so bad. I should be over this. No, it's just here again, right? And eventually you will be getting back to a baseline, back to normal. You can write down, you can journal, you can express your feelings by yourself in some ways, and that can be helpful of just noticing what's coming up for you. We're all often not the best monitors of our own experience. So if you went through a trauma, it's a good idea to jot some things down and notice, oh yeah, I have been feeling very down for 2 weeks now, right? This is happening for me, instead of just kind of going in autopilot after a trauma. Communication with others is also important. If you've experienced it, right, don't bottle up your feelings. Talk to someone who can support and understand you. Help your family and friends by telling them what you need. And it might just be like, hey, I need some space to think about this, or it might be I need someone to talk to, right? Depending on where you're at. If you don't have supportive people in your life, consider a crisis line or professional help, right? If you're engaged and concerned about others who've experienced trauma, yeah, you want to be directing your communication, going back to some of the mental health first aid kind of check-in things, but also realize some people might not be ready to talk to it or might need some time and space as well, and honor and respect that. When it comes to talking to children about traumas, um, it really depends a lot. There's a ton of variables, right, in terms of development, what the trauma was, everything else like that. But some general guidance is, especially if they're older, start the conversation. Don't assume that they're unaware or unwilling to talk about the event, right? Ask what your child already knows and listen carefully, right? Non-judgmentally. If they already know stuff about it, maybe there's accurate or inaccurate information. Um, Maybe they're really concerned. Maybe they're not. Maybe it was just Tuesday to them, but they're aware this other thing happened, right? If they're not directly impacted. Um, Gently correct any misinformation, right? In a very like low key way. Not like you're wrong or you got this backwards, just like, oh, okay, that's not entirely true, something like that. Encourage the child to ask questions directly. Really don't silence your children. Don't say, don't talk about this, don't ask about this. Like if there's a kind of sweep this under the rug habit, trauma is not the time for that, right? In your family or in your community. You want to make it okay for people to ask and express their feelings about it. Also, monitor and limit media exposure, and that's easier said than done today. But don't have your kids with you when you're watching. If you're choosing to watch news about some traumatic event, don't have your kids with you right there. If you've got older kids, be checking in with their social media use. Are they exposing themselves to a lot of traumatic news about an event? Are they obsessing about it? It's generally not helpful. So we want to be mindful of that and be talking to our kids about it. We also want to be clear, research has shown, generally speaking, after trauma, there's some outcomes that we commonly see with individuals and outcomes we commonly see with communities. And I just wanted to talk about those in general. Overall, the research about human beings experiencing trauma has found some really good news, and that's that human beings are incredibly resilient and even resilient to trauma, right? So these statistics are aggregating a couple of studies to just give us some rough estimates. So generally speaking, 70% of people who experience a trauma, they're going to have some symptoms of stress after it, but they'll probably get better in less than 30 days without treatment. This is kind of the people that just need some additional support, maybe some resources, maybe some connection to their community, and then they're going to be good, right? Their symptoms are pretty, or their experiences are pretty much going to resolve on their own. 20% of people are going to experience symptoms after a trauma, and they may meet criteria for PTSD. We'll talk about that later, but they get better in a year without professional treatment. So it's just a slower recovery process for whatever reason. These might be the people who have ongoing stressors. These might be people who don't have social resources. These might be people who have ongoing previous traumas in their life. So maybe for those reasons, it just takes them a little bit better to get there. But within 12 months, they're in a pretty good place. And then that leaves about 10% of people who experience symptoms of a trauma. Again, they may or may not meet full criteria for PTSD, but it kind of continues. And a lot of them don't get better without professional intervention and treatment. One of the things that I want to stress in this is that the most common outcome for people after a trauma is getting better on their own, right? That's 90% of people, right? Whether it's within a month or within a year. But I want to be clear that a slower recovery or not recovering on your own is not weakness, or, oh, this person has something wrong with them, or they're weak or they're broken. There's a variety of reasons that people get stuck in the healing process and can't get there on their own. There's a variety of reasons why some people are more impacted by specific trauma than other people. And there's kind of this, it's almost impossible to quantify how many risk factors there are for PTSD, how many complicating factors can exist in a given situation, and kind of the reason why some people take longer to recover and some people need professional support to recover. When it comes down to it, okay, some people need some more support, and that's the end of it, right? We don't want to make it a label about them or a judgment about them, whether that's yourself or other people. In terms of communities, and this is coming from a lot of disaster research after mass violence experiences, right? They've kind of indicated that, or found that there's a couple different phases that communities usually go through. And this could be family systems, community systems, even society, right? But phase one is the impact. And so this is the hours, the days, the weeks that the traumatic event and then all the stress and kind of chaos and challenge are actually like directly impacting people. So in this mass shooting situation, we might think of it as like the actual mass shooting and maybe like the lockdowns for the next couple of days until we found out about the shooter's fate. Reactions common in this, again, worry, confusion, shock, fear, powerlessness, guilt, help, anxiety might be felt by a lot of people in that community. We also might see people respond with action and engagement, kind of a fight or or flight response, like they're really going to go towards it, or they could withdraw. They could become kind of disorganized, stunned, very passive. That would be like the flight or freeze responses, or they might just kind of have an instinctual desire to kind of connect with people, be around with people in these moments, right? Phase two is this rescue phase. So this might be the initial hours, days, maybe even weeks after the traumatic event has ended. So the traumatic event is over, and we're really focused on, the community is focused on basic survival needs, increasing a sense of safety, increasing a sense of order, kind of a return to normalcy is kind of the goal in this phase. There can be a wide range of symptoms and experiences and emotions at this time. We might see delayed reactions because if people are really responding to that impact phase of the trauma, now that the danger has passed, other reactions might show up. And again, it's a lot of stuff that we've talked about of the kind of common symptoms of trauma. The third phase is a recovery phase. So this would be like the weeks and the months after the traumatic event. Individuals and communities are kind of in this prolonged phase of adjusting to the new status quo, finding a sense of personal and social balance with life after the traumatic event. So like the earthquake happened, what is my city, what does my community look like now? And the adjustment to that is this kind of phase three of recovery. People are returning to their routine tasks and roles. Survival needs and safety needs and stability have mostly been reestablished. So other psychosocial needs emerge, like connection, meaning, right? Some of these other things that people often need after a trauma. They have also found that there's often two phases. Not every time this happens, and it's not clearly or always this distinct, but there's this kind of altruism phase where there's this outpouring of support and attention and resources from near and far for the people impacted by this trauma. And then it shifts into kind of that can lead to feelings of kind of this post-disaster utopia. Everyone's together, everyone's united. Boston's strong, Lewiston's strong. The world's got our back. The United States has got our back. We've got all these resources. And that can slip very quickly and sometimes to a disillusionment phase. So that can be when there's criticisms of the disaster response showing up. Hopeful expectations kind of give way to resentment. Outside attention and resources move on or dry up. And the tensions and inequalities in the community reemerge. So in this phase, I often think of like the Hurricane Katrina in New Orleans, right? In the early days, there might have been a lot outpouring of support in FEMA and everyone, oh, what's happening? But then as time rolls on, there was a lot of disillusionment about that disaster response. And then phase four is reconstruction, and this is really open-ended. This could be months and years after the trauma for the families and communities impacted. as they're moving forward kind of in the long term. Positive outcomes are possible, but it requires work and it's not guaranteed. There's meaning making around the event. And ongoing media coverage may shape how this process unfolds. So that's a kind of really open-ended phase. And I just want to reiterate, sometimes communities come together in this reconstruction phase, and sometimes they kind of fall apart. And it really depends on how everyone contributes and how the community really sees and responds, and like in that moment to that event. Most people after trauma, even a mass trauma, I want to clarify, will not develop PTSD, post-traumatic stress disorder. Everyone, almost without exception, will experience some type of post-traumatic stress. And I want to spend some time here because I think it's important. In our community, in our society, PTSD is a word that's widely used. Its usage in our society has just skyrocketed since 1980. People use it about all kinds of things, like, oh my gosh, I got PTSD from that class. Like, I've heard statements like that from college students, right? Oh, and then I've also worked with veterans who have PTSD, right? But I just want to clarify here, like, post-traumatic stress, that can be like an umbrella term that can apply to maybe all the experiences or symptoms, all the different experiences people have after trauma, right? These can include symptoms that would be part of PTSD, but it's not the same thing as having PTSD. Post-traumatic stress disorder is a disorder that can be diagnosed when post-traumatic stress is showing up across several different areas at the same time. So there's like intrusive symptoms, avoidance symptoms, negative changes in mood and cognition, arousal reactivity. Those symptoms that Chelsea went over earlier, you're having all of them to a certain degree in a current moment, right? This distress has to last longer than a month, right? Because again, these responses are normal after a trauma. They only become kind of disordered when it really persists and lasts longer, right? So a month, 30 days is kind of the cutoff there. These experiences also have to lead to distress and impairment in everyday life. A person has to be really worried by them or limited by them in some ways. And again, to really diagnose PTSD, someone has had to have experienced that really narrow definition of trauma as defined in the DSM-5, right? So even if they have all these symptoms, if there's not a trauma that led to them, according to the DSM-5, we cannot diagnose PTSD. Technically, you do not have it, even if we're seeing all of these symptoms. I also want to stress PTSD doesn't look the same. In our culture, there's a lot of stereotypes in media and stories about what PTSD is supposed to look like. And I think maybe it's because of my experiences at the VA, but just as a person growing up in life, like there was this kind of stereotype of like the PTSD soldier and what that's supposed to look like. And it makes sense because PTSD developed in response to treating Vietnam veterans in a lot of ways. But it doesn't look the same. Someone ran the calculations, and there's actually over 636, 120 ways that someone can have symptoms in combination that qualify for a diagnosis of PTSD. So over 600,000 different ways that PTSD could look like or manifest in someone's life. Now, research has indicated, even kind of, I guess, interestingly to me, certain types of traumas, like natural disasters compared to gun violence, they can tend to produce different types or presentations of PTSD, but that's not always true, right? So just a thing to keep in mind, it might not look like a stereotype, and it might look very different in different people's lives. It can also look different in the same person's life, depending on when we're talking about it. PTSD doesn't stay the same. PTSD symptoms can wax and wane in their intensity, right? There might be a delayed onset in some or all of the symptoms. There might be natural improvement in some areas and natural worsening in other areas. So post-traumatic stress disorder is a very specific thing, and that would be at the people, typically we see this for the people who are more directly and severely impacted by the events that actually occur. I also did want to mention, like, there are specific treatments and treatment options for trauma, whether it's PTSD or just symptoms related to trauma. So within the VA system, There are strong advocates for what they identify as like the top three evidence-based treatments for PTSD. So there's cognitive processing therapy, where you talk about the event, your beliefs around it, and how the beliefs are maintaining symptoms. There's eye movement and desensitization and reprocessing therapy, which is kind of an advanced therapy where you work with a therapist and they have to be trained in EMDR. There's progressive exposure, where you intentionally and on purpose expose yourself in a progressive way and kind of graduated way towards things that remind you of the trauma. You also work with your therapist to imagine the trauma and go over it and intentionally contact that memory over and over and over again. And what we find is with progressive exposure therapy, it kind of burns off all the emotion from it. So instead of, oh my gosh, I cannot go into that elevator because I had this traumatic accident in a multi-story building, it becomes, oh, this is really hard for me. And then that becomes, oh, it just reminds me a little bit of the event. And then maybe after therapy, oh yeah, it's an elevator. I can go into elevators just like I could before this event happened, right? There's a gradual progression there. I want to be clear that that's just like the VA's take. It's not necessarily the final word. There's other treatments for PTSD. Psychedelic assisted therapy is kind of a new frontier that's being done. There's virtual reality exposures where you actually put on VR goggles and you're in some ways exposed to the traumatic event or things that remind you of it. So like putting on a VR headset and driving if your trauma response is related to a car accident or something like that. There's written exposure therapy, narrative therapy, all the other forms of talk therapy can be helpful. And it's not one size fits all. One person might get 90% of their healing from CPT, and that might absolutely not help someone else, right? So again, different people require different things after different traumas. There are different support groups, and there's also group therapy options for individuals. And I think this also helps because it requires and kind of forces connection with others and avoiding that isolation, which can fuel these symptoms and maintain them. Professionals can be involved in those groups in a variety of different ways, from being very directive to just kind of monitoring and noting group process as people are talking about their trauma and going through with it. So there is treatment for trauma. PTSD is treatable. It is not a lifelong disease. I want to be very clear about that. Most people can recover on their own. Some people do get stuck, but there are a lot of effective treatments for people who do get stuck. And Chelsea, I want to throw it back to you.
Yeah, so we've been talking a lot, obviously, about the negative side of trauma. And I wanted to shed a little bit of light on a growing area of research called post-traumatic growth, which is the idea that after an experience of trauma, people can actually have positive benefits, right? That doesn't necessarily negate the trauma or the different symptoms, the post-trauma symptoms that they've experienced, but it can open them up to new ways of thinking and interacting with their lives. And so these areas in particular are the ones that tend to show up the most. And so I'll talk briefly about each area and what it means. So sometimes we see people grow in this area of new possibilities. After an experience of trauma, they become really open-minded to new experiences, new ways of thinking, new ways of engaging with their lives. Maybe they change careers, they do something totally new, or they pick up new hobbies, right? So they really are open to all the newness of life. We also see post-traumatic growth in regards to relationships with other people. This could be finding an increase in your ability to be vulnerable and connect in a meaningful way with the people that you care about, or an openness to even developing new relationships, whereas maybe before you were a little bit closed off. We also see personal strength, right? People come through trauma, by and large, feeling more resilient and feeling more confident in their abilities to handle things after an experience of trauma. Some people experience a spiritual change in which they either deepen their connection with their spiritual or religious beliefs, or they develop new ones, or they just are finding a deeper sense of being and awareness and oneness with their environment. And last but certainly not least, people are seeing a greater appreciation for life following trauma. This could look all sorts of different ways. Maybe they are just content more with the minor pieces of life that they were on autopilot for and couldn't take stock of before. Or maybe they really carve out kind of this genuineness, excitement about what life has to hold and all the goodness in it. So, even though experiences of trauma bring with it a lot of stressful symptoms and different reactions, there can also be a path forward that doesn't necessarily hold just those pieces. There can be some growth that we see after experiences of trauma that I thought was worth noting here. And so, as promised, got a very poorly pulled together, this was me screenshotting from the internet, different apps that I would really, really suggest if you identified any of these different symptoms as ones that fit for you, to look up. The VA, the Department of Veterans Affairs, has done something really wonderful in creating a lot of easy access resources that are freely available, free for use, free for download. And these are just some of them. So we have PTSD Coach, which can be a really good place for you to learn a little bit more about PTSD. Maybe if you've forgotten some of the things that we've shared here, that's a great place for some psychoeducation. It can also be a great place to track your own symptoms, to see if, okay, maybe it's been a couple of months. How am I feeling and thinking about things? In the middle, we have Mindfulness Coach. This is a wonderful way to engage in a little bit more of a mindfulness practice and pulling yourself back to the here and now and anchoring yourself to the moment. It walks you through things instead of you having to read it on your own, which I always loved. And then on the other side, we have Insomnia Coach. If you are dealing with sleep disturbances after a trauma or just in general, this is a wonderful place to connect with some additional information about sleep hygiene, how to take care of your sleep, as well as if you're really curious about it, beginning to track your own sleep and change it in ways that are backed by science to help you get a better night of sleep. So these are some really easy general resources that anyone can have access to on their phones. We've all got them. And I think within the VA, there's also a like desktop online version as well. And I wanted to chat too about resources that are more specific for Mainers, more local resources. And of course, I say that, and the top listing here is a national crisis hotline, but it is freely available to anyone in any state. And it's really cool because it used to be this big, long 1-800 number, but an act of Congress, something they could all agree on, was changing this to something that was super simple to remember. So if you are in crisis, if you are in a situation or you know someone who's really escalated and they cannot calm themselves down, call 988. There is someone waiting on the other side of that line to meet you exactly where you're at and work through a way to keep you safe. We also below that have the Maine State Crisis Line. So this is a place where you can call and connect with someone who is aware of the local resources here in Maine. This is also manned 24 hours a day, 7 days a week. So it really is just up to your personal preference if you're calling 988 or if you want to call the Maine State Crisis Line. Then we've got individual therapy as an option. Maybe you are dealing with some post-traumatic stress. Maybe it's at that disorder level, or it's just general PT or post-traumatic stress. Maybe you have some of those other symptoms that we've talked about, right? Maybe some depression or anxiety. Individual therapy can be really, really useful for exploring how recovery can look for you. Psychology Today is a wonderful place to look through different therapists that you can contact and see if they work for you. Psychology Specialists of Maine, the organization that we work for, offers services, but we don't want to pigeonhole you. You want to find the person who works best for you. But something I will note here is that while most of our providers do have a wait list or have a little bit of a wait to get in to get seen, we do have with some providers, more immediate openings for people who are direct survivors of the Lewiston shooting. So if that is you and you're wanting a little bit of extra help, reach out to PSM and they will see about getting you in the schedule. Can also do group therapy, right? And you can look at different resources. Psychology Today will probably tell you what's local. And then we've got some links here for the mental health first aid and psychological first aid resources as well. So these are resources that you can use in your own time and you can share with others as well.
Yeah, thank you, Chelsea. And just to add to that, we're not trying to advertise for PSM, but I personally am making some time and space and some availability for people who were like directly impacted by this mass shooting. So if they were there, if they lost a loved one, if they're a first responder, law enforcement, otherwise, someone who is really directly impacted by this in a concrete way, I have some limited availability that I'm holding for that. So now we did want to just shift into our